This presentation provides information about the potential uses and benefits of voice and message banking for the children and adults that are served in medical settings. Voice and message banking can be highly beneficial for children and adults with conditions that can make speech difficult or impossible. When a speech-language pathologist is consulted early enough in the disease process, a patient can record their voice and specific messages for future use with a speech-generating communication device. For children with degenerative conditions like brain tumors or juvenile Huntington's disease, voice banking preserves their voices and allows them to be used for communication after speech becomes difficult or nearly impossible. For children with conditions like cystic fibrosis, speech can become not only difficult but exhausting as their health changes. Voice banking and the use of a speech-generating device gives them an alternative to speech that allows for easier communication of their wants, needs, and feelings. A person's voice is a unique and important aspect of his or her identity. A 14-year-old cystic fibrosis patient at Children's Hospital Boston was quoted in John Costello's 2009 article in the ASHA Leader and said, "Losing my voice is like being stripped of my personality." Voice and message banking can help children maintain at least one aspect of their normal communication when they can no longer speak. Voice and message banking also allows more versatility for female speakers and speakers with accents, because unlike with most computer-generated voices, their pitch and accent can be preserved and produced with the speech-generating device. Message banking allows a child to record favorite words and phrases, made-up names, and songs sung in their own voice. These messages, in the child's voice and intonation, can be extremely meaningful to both the child and their loved ones. Additionally, banking his or her voice gives the child the opportunity to be involved in the setup of their communication device and help with decisions about what words and phrases are included in his or her vocabulary. Voice banking can also have benefits for caregivers and loved ones of a child who cannot use natural speech. Parents enjoy hearing their child's voice coming from the communication device and often report that it helps them to feel connected to their child, despite the child's inability to speak. Furthermore, parents often cherish recordings of their child's voice and banked messages, like "I love you," after their child has passed away. Healthcare providers have also found that voice banking can help them to feel more connected to their patients. A nurse at Children's Hospital Boston described her experience with a patient who had used voice banking. She was quoted in John Costello's 2009 article in the ASHA Leader. She said, "I didn't know her before she was too weak to speak, but today when I swabbed her mouth, she pushed a button that said 'thank you' in her recorded voice. I suddenly knew her so much better when I heard the sound of her voice." Voice and message banking can also be beneficial for adults with a wide variety of diagnoses. Degenerative conditions that may eventually impact a person's ability to speak or use his or her voice are a common reason that people may consider voice banking. While voice banking and speech-generating devices are not typically thought of as communication options for patients who will undergo laryngectomies, they are viable choices along with other supports for communication for this population that should be at least presented. A laryngectomy, or removal of the larynx, can be necessary following a diagnosis of laryngeal cancer, after sustaining a severe injury to the neck, like a gunshot wound, or damage to the larynx from radiation necrosis. Common options for communication provided to a laryngectomy patient are esophageal speech, tracheoesophageal speech with a tracheoesophageal prosthesis, and the use of an electrolarynx. These can be effective options that work well for many patients, but they do not allow for patients to communicate with their natural voices. While esophageal and tracheoesophageal speech have the advantage of not requiring handheld devices, a patient who is willing to consider an electrolarynx might also want to consider the idea of voice banking and using a speech-generating device that can produce output in his or her own voice, or with aspects of his or her voice. While a speech-generating device requires that the user learn a new system for communication and may not be as fast as an electrolarynx, it allows the patient the opportunity to continue communicating in his or her own voice, which may be appealing to patients who dislike the way that an electrolarynx or esophageal speech sounds. Even if a patient would rather use something other than a speech-generating device for long-term communication, message banking for a mid-tech communication device would still be a good option immediately following surgery and during recovery. This would allow patients to consider words or phrases they might want to use following surgery and use them in their own voices. Often, when people who are familiar with the term hear voice banking, their first thought is of people who have been diagnosed with amyotrophic lateral sclerosis, or ALS. Patients with ALS are often ideal candidates for voice and message banking because there is typically time for them to bank their voice after receiving the diagnosis, but before they lose their ability to speak. But the diagnosis of other degenerative conditions can be a good reason for a patient to consider voice and message banking. Other motor neuron diseases besides ALS can also lead to partial or complete loss of speaking ability. Conditions like Huntington's disease and Parkinson's disease can also make speech extremely difficult to produce and be understood as the diseases progress. For patients with conditions like these, who may choose or need to use alternative and augmentative communication when speech becomes difficult, fatiguing, or impossible for them, considering voice banking can be an important aspect of coping with a diagnosis. If patients choose speech-generating devices when they can no longer speak naturally, voice banking and message banking can allow them to continue communicating with aspects of their own voice and maintain that aspect of their identity as their conditions progress. The key to giving patients this option is referring them to a speech-language pathologist as soon as possible, before their diseases have affected or taken their ability to speak. Voice and message banking for a speech-generating device can enhance quality of life and communication for both children and adults with serious medical needs. While voice banking is often thought of as a solution for future communication when someone receives a diagnosis of ALS, there are clearly many conditions and situations where voice banking can be helpful and important to patients, their families, and their caregivers. It is very important for a speech-language pathologist to be consulted shortly after a diagnosis of a condition that will result in the loss of speaking abilities. A speech-language pathologist should be consulted as soon as a procedure that will result in the temporary or permanent loss of voicing or speaking has been decided on. Voice and message banking is better done sooner rather than later, especially for patients who have conditions that will lead to the deterioration of their voice or speaking abilities. It may be a struggle for patients and families to think about after receiving a difficult diagnosis, but voice and message banking can have a very positive influence on a patient's quality of life and ability to communicate effectively.